Hi, a very good evening, all of you. Welcome to our first live session of this sixth consecutive week where we have been doing these live sessions, case-based as well as image-based. So in today's live session, we'll go ahead with some image-based discussion from the subject endodontics. So I all hope you had a wonderful weekend, and also you're going to have an amazing week ahead. So another 15 days approximately towards NEET MDS 2022. And also those who are planning for the next year's 2023's exam preparation. This is definitely the best time to start your preparation accordingly. So do let me know how the streaming is going on. If you have any issues with streaming quality, audio or video, do let me know in the comment section. And I think we can go ahead without much delay. Yeah, hi, a very good evening. Yeah, everyone, a very good evening. So in today's session, as I said, we'll go ahead with image-based discussion from the subject endodontics. And before we start, heads up regarding our courses. We've launched grant tests once again, and also we have come up with a new schedule for 1 year course. So crash course and Mission 12 batches respectively for NEET MDS 2022 and 2023. You can find all the details on our website, ptpdacademy.com. We'll start this session with an amazing quote by Swami Vivekananda. Arise, awake, and stop not till the goal is reached. I think this is even more apt now than ever, as the exam is approaching, especially for 2022 aspirants. So, final phase of your preparation. We have been working hard, working consistently. Do believe in yourself. And as Swami Vivekananda rightly said, arise, awake, and stop not till the goal is reached. Right? So with this inspiring quote, let's go ahead with our image-based discussion. Starting with the first image. So you can take 15 to 20 seconds maximum. So you can go through this illustration. I will not provide you any options or inputs, but observe the illustration and see if you can identify the same, and also let me know its practical usage, right? So as you can see, there seems to be a bottle or a can. On it, it's clearly written as Endodontics. So what is it used for? And what's the objective of using this particular material in our profession? Not just in endodontics for that matter, but in our profession. So, there are several tests which we perform in order to assess the vitality of a tooth, right? We want to know whether tooth is healthy, whether it is living or dead. So to assess vitality, we have so many range of tests, diagnostic tests, of which using eyes is one of the means to assess the vitality. So let me review some information from Cohen. Ethyl chloride, minus 41 degrees, can be used by spraying it on a cotton pledget, resulting in formation of ice crystals, and that cotton pledget can be applied on tooth. Alternatively, we have DDM, the one which you are seeing right now, dichloro-difluoromethane, which has a temperature of minus 50 degrees, is a compressed refrigerant spray that can also be sprayed onto a cotton pledget for cold testing. So more recently, we have these ozone-friendly non-chlorofluorocarbon sprays that have been introduced in certain countries. I mean, way back in 2000, early 2000s itself, I heard of these ozone-friendly non-chlorofluorocarbons, which are being released into market, not just about refrigerant sprays, but also various devices, various instruments which actually release these ozone-damaging chemicals. So as you all rightly said, this particular material used for a cold test, to perform cold test, ultimately to assess the vitality of the tooth. And according to Cohen, dichloro-difluoromethane, DDM, minus 50 degrees centigrade, is a compressed refrigerant spray that can also be sprayed onto a cotton pledget for cold testing. And they have highlighted this particular figure, right? Very good. Now, let's move on to the next illustration. So observe this illustration. What you find there is the name of the company, Cipron Endo, and it's written there as Vitality Scanner. So what is this device? What are we talking about? Again, this is one of the tests which we all routinely perform during our day-to-day clinical practice. So what is the relevance of this instrument? Yes, Monica, very good. That's one of the important clinical implications. Cold testing using this DDM, yeah, we can perform vitality testing even in a full jacket or full coverage crown. Very good. So is it apex locator or is it electronic pulp tester or is it an endomotor? I'm glad all the options have been covered in the first 3 or 4 comments. Let's see how many of you are going to get right. So as you can see, so probe, you can see that it's attached to a device and on it, it's clearly written as a vitality scanner. So this is EPT we're talking about. We'll also get back to endomotor a bit later. So electric pulp testing machine, electronic pulp tester, it's used for stimulating, as you know, 8 delta fibers in the pulp dentin complex by applying electric current to the tooth surface. Usually we choose either incisal edge in case of anterior teeth or middle third of the crown portion in case of posterior teeth where the nerve density is considered to be higher according to several studies. And also we have all these false positive and false negative test results and interpretations which are very, very important and one must be very much familiar with the same. So this is an electronic pulp tester. It's written as vitality scanner, right? So that should actually give you a hint, okay? So in fact, as some of you were confused, some of you were saying that it's apex locator, some of you are saying that it could be an endomotor. So to give you more clarity, we have in fact coincidentally incorporated those illustrations as well. So now, identify this illustration. You can see speed, torque, and a device, which is written as X Smart. It doesn't matter what the name of the device is. And also you can, what the company name of the device is, it doesn't matter. But and onto the left side, you can actually see a handpiece as well. So identify this device. What device are we talking about? In fact, this is one of the devices which is most commonly used not just by specialists like endodontists, but also by general practitioners nowadays to perform root canal treatment, especially biomechanical preparation, cleaning, and shaping of the canals. So what instrument or device are we talking about? So as you all are rightly discussing it, endomotor. It's not apex locator. Again, we'll get back to apex locator a bit later. So endomotor, where you can see that the torque and speed can be adjusted. So this is torque and speed controlled electronic device. And also you can find handpiece and also rotary instrument. So this torque and speed controlled endomotor allows precise completion of shaping of the canals. So this is endomotor, right? And by the way, this is not an electronic apex locator. We'll get back to that a bit later. ProTaper, are you sure it's ProTaper? Yeah, there are so many systems of rotary files which are available. Yeah, it doesn't matter what the file is, but this is endomotor along with a handpiece. In fact, even cordless handpieces are available, but it's comparatively costly. Now, let's see how many of you are going to identify this. So those who are trying to say this or identify this instrument for the past 2 slides, and now is an opportunity for you to name it. Third chance for you. So which device are we talking about? So this is considered as one of the important instruments in armamentarium for an endodontist, as well as for general practitioner who is performing root canal treatment, coupled with radiographs, right? Yeah, it's nothing but your apex locator. So you can see apex. So this is your apex electronically, and also you can see the distance from the apex. So what is this electronic apex locator all about? So let me briefly give you some information. Radiographs tactile sensation, presence of bleeding on paper points, knowledge of root morphology have all been used for working length determination. But recently, electronic apex locators are being employed coupled with radiograph, which gives us accurate results in terms of completion of biomechanical root preparation as well as obturation. So the original apex locator was devised by Sunada. So Sunada developed the original electronic apex locator when he suggested that the apical foramen could be localized using a direct electric current. And let me repeat, he said, it has been attributed to him, the development of first or original apex locator. He suggested that the apical foramen could be localized using a direct current. So currently, electronic apex locator is considered an accurate tool for determining working length. So why are we trying to localize this apical foramen? To determine working length. The biomechanical preparation should be within the confines of your root canal, should be extending till where your dentin is present within the root canal. So helps us in establishing working length, and there are different generations which are all mentioned in standard literature, and I'm sure you're aware of the same, right? So this is electronics apex locator. So let me just briefly go through the previous illustrations once again. So to avoid confusion, see, this is your pulp tester, right? Vitality scanner, a pulp tester, electronic pulp testing device, right? And this is your endomotor. It's not a, it's a form of motor. We don't call it as micromotor, we call it as endomotor or electric motor, right? For incorporating these rotary files for completion of biomechanical preparation or simply cleaning and shaping of your root canals. And then you have this another device. So this is your apex locator. So look at these readings here. You have your apex, 1 mm, 2 mm, 3 mm short of apex. So as you place your file, right? So this is a clip. So as you place your file within the canal, it will show the approximate distance from the apex. And also this clip is to complete the circuit, which is placed, you either ask the patient to touch the clip or place it along the cheek and then sanitize it after every patient's use. Yeah, I hope it's clear. Now identify this device. It's again a diagnostic set which helps in a specific condition. So observe this illustration and try identifying what this instrument is all about. It appears like a plastic one. Also, it seems to be having a projected surface, which is a kind of platform where you ask the patient to bite. So I said it falls under diagnostic tests. I said it has a bite platform. So I've given you all the hints. So identify this illustration. Very good. Tooth sleuth, SLOOTH, tooth sleuth. Or crack finder, that's a commercial name. Tooth sleuth has proved very useful for differential diagnosis of various stages of incomplete root fractures. The design of the device permits a chewing force to be applied selectively on one cusp at a time. When this selective force is applied to cracked cusp of a vital tooth, the coronal dentin distorts, which is allowed by the crack and results in a painful response. This sensation is not present in other intact cusps of same tooth. This device can be effective in cotton rolls. Wooden sticks are not available or helpful. In fact, in Grossman, this is according to Cohen. In Grossman, they say, like, when there is pain on biting, it indicates some issue with the periapical area. But when there is pain on release of bite, it could indicate a crack tooth syndrome, one of the clinical manifestations. Very good. So this is tooth sleuth, right? SLOOTH. Now, identify this series of illustrations again from Cohen. So left illustration and right illustration, you can see that right illustration, the tooth seems to be brighter comparatively. And also there seems to be a column or a device, a fiber optic device. So what instrument are we talking about and what is being done in this particular illustration according to your observation? Okay. Some proposals going on. By the way, I love you. Yesterday was February 14th, right? Not today. So in case if you have any confusion or if you missed the time, yesterday was the right time. Very good, Ignatius. So as you can see, we're trying to send in stronger light, LED kind of light. We're trying to pass a light through the tissues, in this particular context, dental tissues, and you can clearly see a crack, right? So trans illumination. Even if you try illuminating your finger, you can find some red shadow. It's because of blood flow, red blood cells, right? So trans illumination, it's one of the excellent techniques for viewing caries, fractures, narrow root canal orifices, and other clinical entities. It's used by passing an intense light through the side of the tooth and can substantially enhance the clinician's diagnostic and treatment abilities. A fracture line or a calcified root canal orifice also have a reduced ability to transmit light, so they appear dark, as you can see in this particular illustration. Transilluminator, terminator. Okay, transillumination. Very good. Now let's see how many of you are going to identify this set of instruments. You can see that these are double-ended instruments, and also on top instrument, you can find that the working portion is very sharp, almost like a probe. And bottom instrument, you can find a spoon-shaped end on both the sides. So what instruments are we talking about? Yeah, transillumination, it is delivered through fiber optic device, which can be in fact sterilized after each patient use. So observe this illustration and let me know what instruments are we talking about. So when compared to a traditional probe, these probes are especially useful because of their extended shank, are especially useful for locating root canal orifices. So let's review some information regarding the same, and in the meantime, you can try answering or identifying these particular illustrations. Very good. So traditional dental hand instruments have been modified for endodontic uses. A typical set of endodontic instruments might include a front surface mouth mirror, a D5 explorer, D16 endodontic explorer, cotton pliers, spoon excavator, pluggers, plastic instruments, hemostat, periodontal probe, and a ruler, working length determination, etc. Endodontic explorer has two straight, very sharp ends. As you can see, this is an endodontic explorer. It has two straight and very, very sharp ends to engage the canal orifices or to locate them. So these have two straight, very sharp ends that are angled in two different directions from the long axis of the instrument, as you can clearly see in this particular illustration. Observe it carefully, okay? And the bottom illustration is your endodontic spoon excavator. Yeah, right. We'll review some additional information. So the mouth mirror should be a front surface mirror, especially when magnifying loupes or an operating microscope are used. Several types of endodontic spoons are available. These spoons have much longer offset from the long axis of the instrument for better reach inside the constricted pulp chamber, right? Longer offset compared to the long axis, and also extending from the shank for better access to these narrow or constricted pulp chambers. The spoons are used to remove carious material and to excise pulp tissue. Therefore, they should be kept well sharpened. Just keep that in mind. So endodontic spoons, the illustration B and illustration A is your endodontic explorer, right? DG16, also an endodontic explorer. This is one of the questions which was posed to me during our post-graduation, like what does DG stand for? Let's see how many of you are going to identify this. One of you said, Anudeep says, Deepthi says it's DG16. So what does DG stand for? Now, try identifying this set of hand instruments from left to right. So left side, you can find an illustration, right, and then extreme right. So identify these illustrations, and these are SCM images of these corresponding hand instruments. Let's see how many of you are going to answer it right. The left image, the center image, and the right image of your screens. So try identifying as many as possible, as accurately as possible. Yeah, so in the meantime, let me review some information. So first of all, I'm sure you're familiar with this color coding, right? So color coding of files, very, very important. Make sure that you are very much familiar with the color coding concept, right? Which we already discussed in our e-classes. And also it's available on YouTube channel, right? So yeah, are these files, are these reamers? What kind of files? Are they K files? Are they H files? So if you observe these both, extreme left, okay, in the meantime, try identifying them. See if you can identify them, and let me review some information. So K-type files, H-type files, K-type reamers. So there are so many files which are available, so many types of files which are available. So in the early 1900s, K stands for Kerr Manufacturing Company, Kerr. So Kerr Manufacturing Company designed and manufactured new K-type endodontic instruments to improve the efficiency of root canal preparation. So this information is from Grossman. Originally manufactured from round tapered piano wire, most instruments are now manufactured from a variety of stainless steel blanks. The stainless steel wire is ground along its long axis into a four-sided or three-sided tapered shaft that is twisted into flutes extending 16 mm, as one of you previously mentioned. So from the top to the tip of the cutting blade. The introduction of NITI alloy for manufacturing endo instruments has improved canal shaping, superelasticity, shape memory, due to improved flexibility as compared to stainless steel. The traditional reamer manufactured from a triangular blank and a file manufactured from a square blank are still made by few companies. However, most manufacturers make reamers and files from similar blanks, and such reamers and files differ only in number of flutes along their blade. So here you can see more number of flutes along the blade. So this is a file, less number of flutes along the blade comparatively. So this is a reamer. And here you can see Christmas cone shaped working areas. So this is your H file. So K file, K reamer, and H file. Okay, so just keep that in mind. So traditionally speaking, all files are manufactured from, when they say file, just get this file into your mind, so that look at the shape of this file, four-sided rectangular. So traditionally, files were manufactured from square blanks, right? Whereas reamers are manufactured from triangular blanks. But nowadays, in fact, we discussed this, all larger instruments are being manufactured from triangle blanks because you need more cutting efficiency, whereas smaller or finer instruments are manufactured from square blanks because they have more fracture resistance, which we already discussed in our e-classes, and I'm sure you're familiar of this concept, right? So what you're finding here, so extreme left is your K file, more number of flutes in a given area of your working portion of 16 mm, and this is your K reamer, and this is your H file. And you can find SEM image of a reamer as well as a H file, right? So this is from Cohen. So just for your understanding on how the instrument is being twisted in order to get a desired shape, okay? I hope it's clear. Now identify this instrument, which is used for extirpating pulp. So what instrument are we talking about? And also you can see corresponding scanning electron microscopic image of this particular hand instrument. So what instrument are we talking about? You might have heard of the term brooches. So you can find various barbs here, right? So this is your barbed brooch. So brooches and rasps were the earliest endodontic instruments used to extirpate pulp and enlarge the canal. A barbed brooch is a short-handled endodontic instrument often used for extirpation of pulp and for removal of necrotic debris, absorbent points, cotton pledgets, and other foreign materials from the root canal. And they have varying sizes like extra triple fine to extra coarse. So many sizes are available as mentioned in your Grossman. Okay. And barbed brooches should not be inserted first in your canal, because there is a tendency of these barbs to get engaged into dentin and they can get fractured. So after preparing your canal, 15, 20 or 25 size, only then you try to insert these barb broaches to extirpate pulp, right? So these should not be inserted into your canal right away. Do keep that in mind. So as mentioned in clinical note in Grossman, barb broaches break easily, especially if they bind to root canal. To avoid binding and breakage, many clinicians avoid the use of broaches and initiate root canal exploration and instrumentation with 10 size, 8 size, or even 6 size K files, as we just discussed. So barb broach is right answer. Very good. Now, let's see how many of you are going to identify this right. You can find a latch type attachment. The shank seems to be pretty long and also a flame shaped working portion. So what instruments are we talking about? So let me give you some additional hints in the form of their use. So these are used for removing lingual shoulder during access preparation of anterior teeth, and also they are used for enlarging the root canal orifices, but only historically. Nowadays, their usage is no longer indicated because they remove the crucial pericervicular dentin, right? So that's again another concept which we discussed in modern concepts of molar access cavity preparation. You can review that in e-classes as well as in YouTube. Very good. Gates, Glidden drill, and one of you says it is lentulospiral. It's not. We'll review that image as well. So what is this Gates Glidden drill? GG drill, as you all rightly mentioned, it has a long, thin shaft, as you can see here. And the ending is a flame-shaped head with safe tip to guard against perforation. So you have this safety tip feature. The frame end cuts laterally and is used with gentle apically directed pressure. The long shaft is designed to break at the neck in this area, so that in case if there is an accident and if the instrument is broken, it should be easy for retrieval, right? So the long shaft is designed to break at the neck, the narrowest diameter that lies adjacent to the handpiece. If the drill binds during usage, it will fracture at the neck of the shaft and will extrude from the tooth. The fractured segment is easily removed by grasping the broken shaft with pliers and pulling it out of the tooth. Yes, very good. So this is used for removing lingual shoulder during access cavity preparation of anterior tooth, including enlarging root canal orifices. And we have total 6 sizes, as you can see from left to right, size number 1 to size number 6. The diameter of size 1 GG drill is 0.5 mm, followed by 0.7, 0.9, 1.1, 1.3, and 1.5 mm respectively, right? So just keep that in mind, starting with 0.5 mm. Now let's see how many of you are going to identify this right. So what instrument are we talking about? You can again find a latch type attachment to which can be attached to micromotor head, handpiece head. So what instrument are we talking about in this particular slide? So again, this instrument has a long shaft, as you can see, and the flutes are comparatively sharp, connected to a thick shaft. It cuts laterally and is primarily used for removing gutta percha post-space preparation. You might have heard that while fabricating post and core. So it cuts laterally and is primarily used for preparation of post-space when gutta percha has to be removed from the obturated root canal. Exactly. So now we are talking about piezo reamer. Very good. And we have piezo reamers again, sizes 1 to 6. Size 1 piezo reamer starts from 0.7 mm. Unlike GG, which starts with 0.5 mm. So make sure that you have this clarity. So in case of Gates Glidden drill, size 1 starts with 0.1 mm and it extends till 1.5. In case of piezo reamer, size number 1, the diameter is 0.7 mm, followed by 0.9, 1.1, 1.3, 1.5, and finally number 6 size 1.7, an increment of 0.2 mm for every next sized instrument. I hope it's clear. It will be in RPMs only. It will be very low speed. Unlike your air router, it's going to be at a very low speed comparatively. Micromotor speed, it will be in thousands, right? So the same can be applied to these instruments as well. Now, let's see how many of you are going to identify this right. It's a penultimate illustration of this presentation. Let's see how many of you are going to get it right. In fact, this was not there in previous edition of Grossman or Cohen. It has been incorporated in later editions, Grossman as well as Cohen. So it's a file system. That's the only hint I can give you. Very good, Shubhangi. 0.7 mm piezo remote, number 1 size. So which file system are we talking about? These are not C files. These are not C+ files, Pathfinder files. No, these are not C files. Very good, Smriti. So what is this SAF? Good. Self-adjusting file system. We can say collapsible mesh. There is no core-like material. And also you can see an angular inlet for delivery of your irrigating solution. Let's review some very brief information given in your Grossman, even though you can find extensive information in Cohen. So self-adjusting file system introduced by Zvi Metzeger. The file three-dimensionally adapts both longitudinally along the cross-section of the root canal system, and this is the most characteristic feature. You take up any file, one of the drawbacks is that since the root canal anatomy is so complex, observe a three-dimensional root canal morphology, it is so complex and diverse. If you take up a traditional file like K file or ProTaper files, rotary files, hand files, it's not possible practically to cover all surfaces of your root canal. But the manufacturers of this SAF claim that this particular file system adapts both horizontally and at cross-sectional level to the existing walls of the root canal. That's one of the advantages they claim. So the file three-dimensionally adapts both longitudinally and along the cross-section of root canal system, and this is its most characteristic feature. This results in uniform cutting action of dentin from the canal walls 60 to 75 microns thick approximately, and preserves the basic shape of root canal. So minimally invasive endodontics, you can consider this. So the design to be used as single-use files, a SAF system consists of a hollow compressible NEET lattice. So what you're finding here, a lattice-like structure that is hollow, compressible or collapsible NEET lattice with a thin-walled pointed cylinder, as you can see here, which has a diameter of 1.5 mm or 2 mm. Do make a note of this point. It is operated with a modified Cavo vibrating handpiece generating 3,000 to 5,000 vibrations per minute at amplitude of 0.4 mm. So consider these specifications important. Another advantage of system is a feature of continuous irrigation, as we have mentioned here, by a silicone tube to the irrigation hub on the file. The device operates with an in and out manual motion using 2 cycles of 2 minutes each for a total of 4 minutes per canal. The file demonstrates increased flexibility as it lacks a metal core and is less susceptible to fracture. So keeping this theory aside, we have a video from the manufacturer's website. I want you to just go through it. So you can find an extracted tooth central incisor. So patency is being established using a 15 size file. So glide path, in order to guide your next file system through the canal, we call it as glide path. And shaping in vertical scrubbing with continuous drip irrigation without pressure, 4 ml per minute. So you can see how this single file system is adapting to the entire tooth, at least in the coronal aspect. And also they're using some suction to remove all the fluid. So to and fro motions. They mentioned about 3,000 to 5,000 vibrations per minute at an amplitude of 0.4 mm. So syringe needle irrigation, always there is a risk of pressure irrigation, positive pressure. With self-adjusting file, yeah, we can go with a negative pressure technique. In fact, we even have systems which work based on negative pressure technique, yeah, which we'll discuss elsewhere, right? So I hope it's clear. Yeah, there is a device, irrigation device by Cibron Endoirecta, which works on a negative pressure technique. So anyways, observe these illustrations, left illustration as well as right illustration where it is being used in a patient. So what device are we talking about? You can see peculiar curved apex of this particular instrument. So what instrument are we talking about? Or what system are we talking about? Yeah, Endovac system. Endovac system is the one which works on negative pressure technique. It's an irrigation technique. Anyways, what about this particular illustration? Very good, Smriti, Viso, Welton. You don't know? Sienna, it is Apexum, right? So Apexum device, it's nothing but, as you can see, we'll try to pass this instrument through the apex, and after completing your root canal biomechanical preparation, you'll pass this instrument, NITI-based instrument, through the canal, and then you'll try to use a coarse instrument and a fine instrument to liquefy the material in the periapical area, infectious material, and then try to drain it. It's a unique kind of system. So let me review some information in brief. The Apexum device, Israel-based, is currently the single representative of a particular group where the instrument goes beyond the apex, right? It represents a totally different concept that is applied by most root canal cleaning and shaping systems. Because if you observe any root canal cleaning or shaping system, we stay within the confines of root canal, but in this system, we're going beyond the apex. Apexum concept requires widening of apical foramen to create an opening of 330 microns in diameter by passing the 30 size file 1 mm beyond the apex. This may represent some enlargement of apical foramen in certain cases, but in other cases, the natural apical foramen diameter may be larger than this. Further instrumentation with larger instruments, either 40 size or 45 size, to a length of 1 mm short of apical foramen are then used to create an artificial apical stop and constriction. So the reason why we're trying to open up the apex is so that we can pass this instrument, Apexum device, through the apex into the periapical area. Two miniature devices are then used to debride the periapical tissues through the root canal axis. The first is a coarse Apexum ablator, which is made up of a pre-bent memory shape. So this is your pre-bent memory shaped one, which is enclosed within this sheath. You can also find this sheath here, okay? So a coarse Apexum ablator, which is made up of a pre-bent memory shaped NITI wire encased in a NITI tube that serves as its sheath. The instrument, still encased in its sheath, is inserted to the artificial apical stop. Then the inner wire is gently pushed through the apical foramen and into the periapical lesion. Once the wire is sent into the apex, since it is pre-bent, NITI has this memory of shape, right? Shape memory. So it again curves, and then it so that the surface area is increased, and then you keep rotating it. Ablation, right? Coarse ablation. So while in the periapical area, it regains its pre-bent shape. It is then attached to a low-speed handpiece and then rotated at 250 RPM for 30 seconds. So they specifically mentioned the speed. Very low speed, 250 RPM, 30 seconds with this coarse ablation. The first instrument is then removed, and the second instrument, that is fine apexum ablator, is inserted, passed through apical foramen, rotated 7,000 RPM for 30 seconds. And then we wash out using a 30 gauge blunt needle, where the entire area gets liquefied, the infected area, and it is drained through the root canal, right? So this is your apexum device and how it works. The method is used as a supplementary treatment for enhancement of healing kinetics of periapical lesions. Yeah, for promoting faster healing. The apexum procedure is applied only after completion of cleaning, shaping, and disinfection of root canal and before root canal obturation. This interesting device will clearly be subjected to additional research over the next few years, as mentioned in Cohen. And what you're finding in the right illustration already, guys. Apexum in clinical use, the coarse apexum ablator in a periapical lesion of an upper single-rooted tooth, and also you can see the sheath is intact, right? The root canal obturation immediately after apexum procedure has been completed. So this is a bit strange concept because most of the concepts which we learn in endodontics, we say that we should stay within the confines of root canal system, but in apexum device, coarse and fine ablation apexum device, we are going beyond the apex, right? Yeah, it is nitide. It is made of nitide, or else this shape cannot be regained. Nitide has this ability to memorize the shape and regain its shape, no matter how it is bent. So there are two important features related to nitide, which are used in endodontics, orthodontics, and various specialties: shape memory and super elasticity. Do keep that in mind. Now, very good, it's apexum, as some of you rightly identified. This is a homework question. I know it's comparatively challenging, but let's see how many of you are going to get it right. The size of the instrument, which you can find on the right side of the screen, is 25 size, and it has a 2% taper. By the way, it's a H file, as you can clearly see. It doesn't matter what kind of file it is. So the size is 25, red color coding, and it has 2% taper. I'm not going to describe what 2% taper stands for, because if I give you the description, you'll get the answer. We discussed that previously as well in e-classes. YouTube, you can check it out. So the question is, what is the tip diameter of this 25 size 2% taper instrument? And second question, what is the diameter of 1 mm and 2 mm above the tip? For suppose I cut this instrument by 1 mm, what would be its new tip diameter? If suppose if I cut the instrument by 2 mm from here, 2 mm, if I cut the instrument, what would be the diameter of this instrument in its new tip, which is 2 mm short of the original tip? I hope you got my question, right? So the size of the instrument is 25 with 2% taper. What's the tip diameter? And what's its diameter? 1 mm and 2 mm above the tip. So this is your tip, 1 mm above the tip, 2 mm above the tip. So what would be its diameter? Consider this very, very important, because previously also there were questions along these lines. If you have any confusion whatsoever, but before you have any confusion, I want you to attempt this question and get back through mail for key analysis and guidance from our side, right? So this concludes our today's image-based discussion made easy from the subject endodontics. Okay, it's good to see that some of you are already attempting to answer. I want you to put it on paper, make a calculation, and get back through mail for further guidance. I really appreciate your enthusiasm. So I hope you guys have enjoyed this session, and in the upcoming days, we'll incorporate more image-based and case-based questions as well, and your feedback is always welcome. And I wish you all the best. And as the exam is approaching, I do understand how you must be feeling. I've been getting several mails where students have been complaining about feeling of anxiety, feeling of depression, feeling of frustration, and feeling of uncertainty given the situations we are in, especially after NEET PG postponement. Many of the aspirants have been having this doubt or question whether NEET MDS would be conducted as per the schedule. We have been checking the official websites along with you as well. But all I would suggest to you is there are certain things which are not in our hands. We'll obviously do our best, right, to get things done in our way. But sometimes it doesn't go in our way. So does it mean we should stay frustrated, anxious, and affect our present moment? That would definitely be a foolish approach. So all I would suggest to you is exercise patience. I know it's very, very frustrating. I can understand, because given the situations we are in, it's not just about pandemic. For various other reasons, NEET MDS has already been postponed for the first time from December to March. And again, the thought of postponement would stir up all negative feelings possible. I would sincerely request all of you to please exercise patience and focus on what best you can do now. For suppose for the past 30 minutes or 40 minutes, you have been going through these image-based discussions. Are you worried in this process while attending this session that the exam might get postponed, or were you focusing on the given illustrations and trying to listen to my inputs? So that's my point. So whatever you're doing right now, focus on that. And if in case there is any news, it's not that a particular news or the news related to NEET MDS is only customized to you. Obviously, that news affects everyone equally. Even though it doesn't affect everyone equally, at least the news is the same for everyone. But depending on how you take it, you will be affected. So don't get carried away by all the rumors. Anyone has a right to approach court for justice. We cannot blame them. And I mean, it really needs some sense and understanding to be in others' shoes and to understand what he or she might be going through. So let's not judge people. Let's not point out fingers. Let's not blame others. It's a very complex, challenging problem which you're all currently facing, especially when it comes to exam conduction under these challenging times, especially when it comes to loss of eligibility for some select interns for no fault of their own. There are so many events that are happening. But keeping all those aside, I would suggest you to focus on what best you can do now. And if there is some news affecting NEET MDS, remember the news is for everyone and not just for you. But not everyone will be reacting the same. It varies on one's perceptions, and you can buffer yourself from all the negativity by believing in yourself. Exam will be conducted for sure. Exam is not going to get cancelled, right? Exam will be conducted for sure. So if you have that assurance, then why worry? I hope you got my point. In good spirits, and if you have any queries, you need any assistance, yes, feel free to get back through mail 24/7. We're always there for you. And we have been getting several mails of late regarding these queries, like, as I said, feeling of despair, feeling of frustration, disappointment, anger. One of the aspirants actually mailed saying that every day they wake up, he or she is suffering with anxiety or panic attacks, and they are really anxious about what might happen to the exam day. See, there are certain things which are not in your hands, and please do not worry about them. But what's there in your hands is your thought process. What's there in your hand is your preparation 100%. So please keep that in mind. Today's session was actually challenging. In fact, consider that as a good sign. If you found this challenging, which means you had plenty of opportunity to learn from this particular session. And if at all there are any questions, right, coincidentally, from these sessions in your upcoming entrance exams, then I'm sure you're not going to repeat any of the mistakes, isn't it, Sai Rajat? Yes. In fact, we are also pitching for the same. We don't need any further postponement. However, those interns who are losing eligibility criteria, why can't DCI provide them an exception, as we already mentioned in an elaborate letter, which we wrote down to the president of DCI. So anyways, let's hope everything goes as per the schedule, and I wish you all the best and luck. Keep in touch, and I'll see you again tomorrow at 9:30 p.m. in another image-based live session. Take care. Good night.